Hello, I'm Dr. George Ampat. I'm a consultant orthopedic surgeon. I work in Liverpool in the United Kingdom. I'm going to talk a little bit about knee pain and hip pain and mainly about knee pain. People experience knee pain and they are worried. And when they are worried, they don't move the muscles and the muscles become weaker, increasing their knee or hip pain. It is important to exercise and keep the muscles strong. Let me give you a metaphor to make this clear how strong muscles help to keep the joint good. Let's take a car for example. My car, the manual says that the tires have to be inflated to 40 psi or 40 pounds per square inch. If the tires are well inflated at 40 pounds per square inch or adequate pressure, then the tires are plump and the car drives very well. But unfortunately, if the tires are not plump and they are underinflated, say the tires are at 30 psi, because the tires are underinflated, the tires will tend to wobble. The car will tend to wobble if I drive with the underinflated tires. If they wobble a lot, that wobbliness has to be taken in or should be neutered by the shock absorber. So there is an excess stress on the shock absorber. Whereas if the tires are plump, there is no excess stress on the shock absorber and the shock absorber will last a lifetime. But if the tires, as I said, are underinflated, there is an increased wobbliness in the car, excess stress to the shock absorber, and they are going to wear out quickly. And that is exactly what happens in the human body. The tires are the muscles and the shock absorber are the joints. If the muscles are strong, there is no abnormal movement of the joints and the joints last a lifetime. But if the muscles are weak, then obviously when you do any activity, there is an abnormal movement, and that abnormal movement is going to cause wear and tear in that joint and arthritis. So though we call wear and tear, we wrongly assume that doing more actually causes arthritis. That is not the case. Evidence shows that actually if you use the muscles more, there is less chance of arthritis. It is the abuse that causes the arthritis, not the overuse. If you use it well, in the right way, and stress the joint, it doesn't cause arthritis. A study called the runner study examined people running over the age of 50 and who were running. They compared it with a group who were over the age of 50 and who were not running. The people who were running had less arthritis, less need for hip and knee replacements, and actually they lived longer than the other group who were not running. The group who were not running had increased disability, more hip and knee replacements, and they died earlier than the people who were running. So actually running an activity is protective not just for the joints but also for the heart and lung. The worry of every exercise enthusiast is that running will damage the knee, but running doesn't damage the knee. So it is strong muscles that are important. So if you have knee pain or hip pain, how do you address it? Now unfortunately, if the way some people do is they go and see a doctor, get a surgery forced on themselves. They do, a telescopy is done. But there is evidence to show that telescopy harms the knee and may actually worsen the symptoms in the knee. So the best method is to build up the muscles around the knee, and that is all that is required. I am going to show you just 3 simple exercises. And I want you to do these repeatedly, and by doing it repeatedly, you can make your muscles strong. I would like you to do each of these exercises 50 times every day. Now you can't do 50 times in one sitting, it would be too tiresome. So you need to split it out. What I suggest is doing 5-5 every 15 minutes. So you may want it, you can do it while you're at work, or you can do it while you're in the evening while you're watching television. So if you're doing it while you're watching television, every time there is an advert break, do these exercises and build up the muscles around the knee and your hip. So let me show you what these 3 exercises are. You want to start with a lower weight and slowly increase the weight as months go by, so that you're putting an increasing weight and increasing force on the muscles to make it stronger. Let me show you how to do this with weights. So I'm going to start off with small weights. These weights are only half a kilogram each. So I'm going to attach these weights to both my legs and I'm going to do the 3 exercises. Then I'll show you how we can do the same exercises with a greater amount of weight. But you want to change the weights only once in a month and slowly progress. And each time, every day, you're repeating each of the exercises 50 times on each leg, but don't do it at the same time, it is going to be too tiresome. So put the weight in front of your thigh, lower it down to your ankle, take the strap, pass it through the metal buckle, and fasten it tight around your ankle. You want to apply the weight over some clothing. So either it can be quite high socks or some trousers like this, so that the weight is not directly chafing your skin. You need to take special care, especially if you have had an ulcer on your ankle, or people have venous ulcers on their ankle, and you need to be careful. So I have now fastened the weight on my left leg and I am fastening the weight now on my right. Ideally, the weight part should be in the front of the leg or the ankle and the strap should be on the back. So now I have fastened both the weights on both my legs. So I'm going to do 5 exercises on this, 5 exercises on this, only 3 exercises, not more. The 3 exercises are quadriceps, hamstrings and gluteus, nothing more. Just 3 simple exercises, but repeatedly. And doing that for 4 to 6 weeks is going to make a big difference in your knee pain or even hip pain. So I'm going to show you how to do 3 simple exercises and potentially help with your knee and hip pain. It is important that these exercises are done repeatedly, and slowly over the months you can increase the weights. Every month you can put a half a kilogram higher and slowly go up. Start off with a small weight. You don't want to put a heavy weight when you start. So I only put a half a kilogram on each of my legs. So I'm going to do 3 exercises: the quadriceps or the front of the thigh, the hamstrings or the back of the thigh, and the gluteus or the side of the hip. So doing the quadriceps. So while seated in a comfortable position, I'm straightening my leg and bending it down. The timing is 1, 2, and when I bend it, it's slightly slower at 1, 2, 3. So I'm going to do it 5 times on this one. 1, 2, 1, 2, 3. 1, 2, 3, 4, 5. Now I'm going to repeat on this leg the same exercise. 1, 2, 3, 4, 5. So that was the quadriceps or front of the thigh exercise. For the next 2 exercises, I'm going to stand up and show you how I'm going to do the exercise. I'm going to remove this chair, or if you want, you can hold the back of the chair for support. In this case, I'm going to move the chair and I'm going to stand at the back of the chair. You don't need the chair, but you can have the chair for support. So I'm going to show you how with the chair you're supporting yourself. So I'm going to stand at the back of the chair, and now I'm bending my knee backwards. But it's important that my thigh is kept parallel to the other thigh. It is bending in the knee, but this would be the wrong bend of the knee. What you need to do is to bend it backwards like this. So that way you are stressing the hamstring muscles at the back of the thigh. So I'm going to do 5 times on this leg. 5, 4, 3, 2, 1. Then we need to repeat it on the opposite leg. So on the right leg, 5, 4, 3, 2, 1. You would have noticed that my thighs were parallel to each other and the thigh did not come to the front. And lastly, I'm going to show you how to do the third exercise, or the gluteal medius exercise of the hip, the side of the hip. So you can hold, actually you could be standing behind the chair and holding the chair for support. I'm not going to do that so that you can see exactly what I'm doing. So your feet should be pointing forwards and you're lifting your legs sideways, but you're leading by the heel and not turning your foot outwards. If you turn your foot outwards, you're using a different set of muscle, and that is not beneficial. You need to keep your foot facing forward and only lift it sideways, and thereby you're only stressing the gluteus medius muscle or the side of the hip muscle. So standing like this, 5, 4, 3, 2, 1. Now we can do it on the opposite side. 5, 4, 3. Yeah. So I'm going to do on the right side now. 5, 4, 3, 2, 1. It is important to note that I have not twisted my foot outwards at all, and throughout I was maintaining by keeping the feet pointed towards the front. So those are the 3 exercises, but the trick is to repeat them, to do them 50 to 60 times every day. And the way to do that is to spread it out over a 3-hour period or a 4-hour period. So if you are watching TV, every time the adverts come, so say the adverts come on every 15 minutes. So in an hour, you have 4 opportunities. So every 15 minutes, do 5 on this quadriceps, 5 quadriceps on this, 5 hamstrings, 5 hamstrings, 5 gluteus, 5 gluteus. So in an hour, if you have 4 opportunities, in an hour you have done 20 times. In 3 hours, you would have done 60 times. That is all that is required. If you repeatedly do that 60 times, you're going to find that your knee pain and your hip pain is improving. Now, every month, if this is the 1 kilogram is less and you don't think it is giving you enough stress, then you can put a bigger weight on. So I'm going to show you one with a larger weight on. So I'm taking this weight. So I have weights of different sizes, but on both the legs, you need to use the same weight. This is the smallest weight that I have. Then I have slightly bigger. This is a 1.5 kilogram each, and I can put it. So after, say, half a kilogram per leg the first month, in the second month I can go 1 kilogram on this leg and 1 kilogram on this leg. In the third month, I can go 1.5 kilograms on this leg, 1.5 kilograms on this leg. In the fourth month, you can go to 2 kilograms on this leg and 2 kilograms on this leg. And that is what I'm going to do. This is a 2 kilogram weight. And with time, the strength of the muscle improves. So I'm going to put the 2 kilogram weight and fasten it around the same way. So now it is a bigger weight that is on my legs. So I'm going to repeat the same exercise, and same, you need to do it 60 times in your third month with this higher weight. So starting with this left leg, 5, 4, 3, 2, 1. It is okay to slide your foot on the floor. You can sort of scratch the floor, and then, because that is the way this exercise has to be done. But the timing is 1, 2 on the up and 1, 2, 3 on the down. Now on the right leg, the quadriceps, 5, 4, 3, 2, 1. So next, I'm going to show you the other 2 exercises which we can do by standing up, and I'm going to remove the chair and the other weights to show you how I'm going to do that. So I'm going to remove the chair and the other weights. The weights are very effective. If I put, this is about 2.5 kilograms on each leg, and trying to walk with those weights is actually difficult. Yes, I may be large, I weigh nearly 90 kilograms, but these weights may be only a fraction of my weight, But as soon as I attach the weight, it actually increases the load that the leg has to carry. And that is how the muscles gain increased strength in a very short time, 4 to 6 weeks, and you're going to find a beneficial effect. So we have done the quadriceps while sitting. Now we are going to do the hamstrings, keeping your thighs parallel. Your thighs are not moving to the front, and you're bending your knee backwards only, a pure bend backwards. So starting on the left, 5, 4, 3, 2, 1. And on the right, 5, 4, 3, 2, 1. So that was the hamstrings. The last exercise is to do the gluteus on the side. So if I'm facing you, you can hold on to the chair if you want, or the back of the sofa. So doing the gluteus on the left, 5, 4, 3, 2, 1. So see that the feet are pointing forwards always. Now on the right, 5, 4, 3, 2, 1. So this, we have completed the 3 sets, but it is a repetition of this, and slowly over the months, if you increase the weights, that is when you gain benefit from your knee and your hip pain. Thank you very much.